Yeah, I'll pray not.
Breast augmentation remains one of the most common cosmetic surgeries in the U.S., but has become more health conscious. Natural alternatives are something we're looking to, while our options are changing. Dr. Bill Johnson of Innovations Medical is here to tell us why natural breast augmentation is one of the fastest growing areas of cosmetic medicine. I'm very interested because that's very true. Natural is trending right now.
Yeah, natural is trending right now. And when we talk about natural breast augmentation, what we're talking about is using your own fat that we get from liposuction to enhance the breast. And so that's one of the reasons it's really popular is there's no implant, there's no foreign body, it's all you. There's not a chance of reaction, there's not a chance of a capsule forming and contracting. We don't have those issues. It's also a great 2-for-1 because you get the liposuction and shaping of that area at the same time you're getting the breast augmentation for roughly the same cost as implants.
And you don't have to worry about maybe those concerns that might be 10 or 15, 20 years down the road.
Now, there are no concerns about that. That's correct.
So then how does the process work?
Well, first we give the patient a little sedative to make them kind of mellow and sleepy. And then we use special cannulas to numb the area we're going to liposuction and to numb the breast. Next thing we do is liposuction the fat into a special container so we can reuse it.
Okay.
Then after we've liposuctioned, we'll run the Smart Lipo over the area we liposuction to make it nice and tight and get the shape we want. Then we take the fat and we actually pump it into the breast, and we can use that to shape the breast as we're going. And that's the long and the short of it.
Okay, well, it's teeny time. I appreciate that. But you mentioned shape a few times. What about size? Fill us in on that.
Well, that's always a big issue. People always say, how big can we get? Can I get 1 cup size, 2 cup sizes? The things that determine the size, there's several factors that go into it. How much fat are we liposuctioning? So how much fat are we going to have available to put in?
Sure.
And then the shape of the skin on the breast, which you can only stretch it so much. So both of those things determine size. But the other thing that you kind of folks have trouble getting their head around sometimes on size is a big woman that's a 38 bra. It takes a lot more volume to get a cup size than a small woman, a 32 bra. To get a cup size in that takes a lot less volume. So all of those things are things that we can talk about in person.
Okay, and what I appreciate is that I'm sure the outcome actually looks even more natural than maybe an alternative.
Yeah, it really is a natural shape and a natural look. It doesn't have a balloon look or a melon look as so often you see with implants.
Yes. What about, who would be a good candidate?
Well, almost anyone that's interested in breast augmentation can be a good candidate. And if folks are interested, they can call and talk with one of our trained consultants. They can kind of walk them through the process and give them an idea of expectations. If they decide to go on that they're interested, then we meet for a pre-op with me, and we actually try and make sure that I understand their goals and they understand what's actually achievable.
I think a question that many women may have is the time. Everybody's very busy. They have packed schedules. Recovery time.
Well, the recovery time is really pretty simple. The breasts go very well. The liposuction usually 2 to 3 days, and you can go back to work for most folks.
Oh, that's great.
And you'll have some swelling and tenderness in the area for a few weeks, but most people go right back to work and sail right through it.
Okay. If we have piqued your interest, I suggest you give him a call and have more of a conversation in person with Dr. Johnson. He wants to see you and see how he can help you out. Here's the number. It's 214-420-7970 or 817-438-8319 for more information. Set up that free consultation.